So we are going to extract alveoloplasty, then place 1121 implants. When I saw some surgeries done in abroad, what they are doing is, after placing incision, opening the flap, they are using cautery first to arrest all the bleeding. So it becomes totally a dry field. Then they work relaxedly. Why we become tense? No, we lost patient's control is because of the bleeding happens, suction, 2 suction, 3 suction. The assistant becomes tense. No. So bleeding control is very much essential, especially perio cases. Now the second premolar implant. So this is the second premolar implant. If you see the second premolar, there is short length available. After that sinus comes, but if you tilt slightly mesially, you may get good bone. So that is the entire concept of all on 4. This X-ray will explain about all on 4. Okay. So just a 10-degree tilt, you are in good bone. If you place straight, less bone, we are entering the sinus. Just a small tilt, we are entering in good bone. Up to 18 mm implant we can place. Okay. So here what mistakes we will do now? Instead of tilting this one, we may tilt very less and may enter the sinus. That is a mistake. Or we may tilt too much mesially.
But anyway, even though you tilt too much mesially, we have the concept of bending, right? We can take it.
No, the tip should not go and meet the adjacent implants. No. Even if the tips are close to each other, that is not a problem. Tip level, the implants touching also not a issue. Okay, only in the crystal level, no, they should not be close to each other. But still, how to correctly identify this angle? There is one or two tricks. One is, you have to open the flap till here. Open till the nasal floor. Okay, you can see the nasal floor corner like this. So mark that with pencil, here mark with pencil, connect with the line and do the drilling just exactly parallel to that. That is how many people are doing, using pencil. In the armamentarium, pencil will be there. Pencil is the most important instrument. And one more trick is, what I do is, I just tilt, I do drilling slowly. If I am entering the sinus soon, that means my angle is more vertical. So I change a little bit now, slightly mesially, then I drill. That is what me and my circle they are using. Or if you have time, you can take IOPs, do the drilling, only 4 or 5 mm, take IOPA, whether it is, what is the relation between the sinus floor and your drill, you can change the angulation. That is one option. And one more technique is, during drilling, see this part, no? This part. Okay, this part. This part is this part. Okay?
I love this.
Yes. You can keep your finger and you can somehow visually you can guide that. Because our target area is this one. Okay. There is one more technique is there. Imagine if the sinus is coming till here, then you have to shift this entire implant till here, no? Then cantilever will increase. But what is the technique is, you can go through the sinus and then go and catch this.
Meaning to say very close to the...
Yes, you enter the sinus here, then catch this bone. This is called trans sinus implants.
Then that applies to pterygoids also.
Yes, trans sinus pterygoid is there. Okay, this is also there. There are certain group of doctors, what they are doing is, they open the sinus, they make a window here and they elevate the sinus membrane and they place the implant here. Okay. And they put some bone. So what we do is, even if the sinus is coming, we go through the
just
sinus.
like piercing through the sinus.
Piercing through that.
But no problem.
I'll show on X-ray. Actually, it was unplanned. Okay. Instead of tilting like this, I was going like this. So it went into the sinus, then it went into the catching the palate. Okay.
But
So-
if patient is having some sinusitis and problem, will they get
No,
any
if
problem?
that is what you have to analyze before. If it is a sinusitis case, then we should be very careful.
Avoid
These
that
are
kind
healthy
of
sinus,
sinus should be avoided completely.
Healthy sinus, no issues. See, if you go along the premolar, you will enter the sinus. The sinus is expanded till bone. But if you tilt 15 degree something, mesially you are getting good. So 4 into 16 will be a correct size. Okay. So this is our initial planning. Here we do 1 molar cantilever. Here we do 2 tooth cantilever. But the patient is young, right? If you want to give more support, then you can give 2 pterygids or 1 pterygoid. We are comfortable with this side. 1 tooth cantilever is not a problem. But only the problem. So only lifted pterygoid also we can do, or even with this also we can leave it. We'll see. As I already told, we have not done any all-on 4 with the multi-unit single piece.
In this case we do. This case you're going to do.
I don't know. Pterygoid we have to check. If it is quite easy, we can do pterygoid. But the problem is, see, the patient was having this mobile 8. They are like diving, jumping into the lower jaw. So this kind of infected cases, they reduce the bone, the tuberosity bone resorb. It makes the thing complicated. See, there is no tuberosity at all. It has been eaten away by the periodontitis. Even if you put a compressive implant, the top 4 or 5 threads will be in the socket. Okay. See, this is a tuberosity. This is a pterygoid. Not a very ideal pterygoid on left side. Okay. Now we will see the right pterygoid. Right pterygoid is somewhat okay. This is the tuberosity area. This is the pterygoid. This is the fusion zone. This is the lateral pterygoid. This is the medial pterygoid. Both sides, crustally the bone is not good. Right? That is what I told. Slide towards the medial tilt. If you drill straight. So tentative plan is all-on 4. You will see. But here you can place a BCS implant.
Basal, the pterygoid.
Basal. Screw-retained basal. Because crustally no bone, no? You don't, only this part. But the problem is, Violent doesn't have that model, Simpledent is having. So we have to use a Simpledent BCS here. So in front it will be Violent and pterygoids, only